You're tuned in to More Living with Jim Brogan, broadcast live from the Brogan Financial Studios at News Talk 98.7, where old-fashioned values, expert knowledge, and genuine understanding come together to give you the retirement straight talk you deserve. Jim's a former National Advisor of the Year recipient and a financial educator, and he's here today to talk about how you can live out the best years of your life. Jim and the Brogan Financial team have been helping retirees and pre-retirees across the Southeast for over 20 years in their pursuit of financial independence. You can reach them during the week at 865-862-6800. So sit back, relax, and get ready to learn, because More Living with Jim Brogan starts now.
Hello, East Tennessee, and welcome to More Living with Jim Brogan, where it's all about living the best years of your life your way. You're listening to News Talk 98.7 WOKI, and I want to say a special congratulations for Dawn around the house and all the great shows she put on over all these years. I know the show's going to continue on just great. But, of course, she built the core of what that is, and it's been such a great show for so long, and she's become certainly a good friend of mine as well. It's that time of year when spring brings those itchy, watery eyes, runny noses, and sneezing. Sometimes you even see the pollen haze in the air. You know, allergies are a major public health concern every year. Seems to me it's getting worse over time, with more than 50 million Americans suffering from seasonal allergies. In Knoxville, while we certainly live in a beautiful place, it is consistently ranked in the top cities in the United States that are the most challenging for allergy sufferers. Our guest today is a good friend of the show, Dr. Ty Prince of the Allergy, Asthma, and Sinus Center. He's a Knoxville native, been practicing for over 25 years, and is a specialist in adult, adolescent, and pediatric allergy, asthma, and clinical immunology. Good morning, Dr. Prince.
Good morning, Jim. Thank you for having me.
Yes, it's great to have you. Do we have his mic? Are we good? Okay, to go ahead, talk again, Ty.
Okay. Can you hear me now?
Yeah, you're not on. Tell you what, let's move over here, Ty. Sorry, we're getting him situated. One of the things that I did want to ask you is regards to the cold weather we had last weekend. It was kind of interesting. We had gone on spring break with our family, and we were in the south, and I didn't realize how cold it was in Knoxville. And we were coming back Sunday, and I realized Saturday we were going to have a hard freeze over the weekend. Mm-hmm. But we got you with us now. Good morning. Okay,
you.
So it's great to have you with us. You've been with us. It was about every year here talking about allergies. What happened? I mean, is that going to make things worse in April? Is it going to help things, the fact that we had a hard freeze for a couple of nights in a row this late in the season?
It will slow the pollen down, and will slow the mold down in it all, but it'll slow the pollen down for a couple of weeks sometimes. But you have sequential trees pollinating, so the ones that the buds get cold and don't quite pollinate as much quickly, others will pollinate and follow right behind it there. So we're back up to very high levels of pollen.
Okay, so it doesn't necessarily kill it; it just delays it a little
exactly.
bit. Well, we were seeing trees in full bloom. I mean, we had such an unseasonably warm February, and it's just a matter of time. I know we're going to see our cars covered in yellow pollen. Yes. We had that down in Columbia, South Carolina, a couple of weeks ago. We were down there visiting Dee Dee's family, and it had already hit down there. And I mean, just overnight, a solid coating of that yellow pollen. What are the primary irritants affecting people right now in Knoxville?
Right now, we have several different types of trees. We got pine and cedar, maple and birch, and sweet gum are the trees that are out right now. But see, we also almost always have a moderate amount of mold as well too, and that you can pretty much go by how wet the ground is and how much mold you're going to have.
And you say that hadn't really been affected at all by the cold weather we had last weekend.
Not at all.
So our first instinct when our allergies are triggered is to reach for over-the-counter antihistamines. What are some of the best treatment options for seasonal allergies? And is it good to get ahead and start doing things before we start to see symptoms?
You can. Your most effective medications are going to be your topical nasal steroids. So Flonase, Nasacort, Rhinocort. Some of those are over the counter now. Some of them are a little less expensive to get a prescription for them, and you'll get typically a larger amount. A lot of the over the counter cortisone nasal sprays only have 25 days in them, so don't be fooled. You'll have to pay tax and get a 25-day supply where you can write a prescription and get a 30-day supply and not have to pay taxes on it. Maybe just pay your copay. But for sure, the nasal steroids are your most effective. Be careful if you have glaucoma, you can't use them. Open-angle glaucoma, you can't use nasal steroids. But yes, starting those a day or two before the pollen comes out, it's going to make a big difference because the nasal steroids, you have to use them regularly, and it takes a day or two before they really kick in.
So it's safe to use those every day?
As long as you don't have glaucoma, nosebleeds, or any other condition that contraindicate them. And then you take your non-sedating antihistamines in the daytime as needed. That's your Claritin, Allegra, Zyrtec, and Xyzal. Those are all purchased over the counter, and they're non-sedating. The stronger medicines, your Benadryls, your chlortrimetons, your Tavist, those are going to lead to some drowsiness and some more side effects as well too. So you have to be careful with those. We don't recommend you drive or operate machinery when you take those. So those are evening type medications to take. Yeah,
if I ever take a Benadryl, it's going to be at night right before I go to bed.
Well, it's a sleep aid. It's not a good sleep aid, Jim. You're going to still wake up tired. It's something good to use when you just can't get to sleep, and it's better than nothing. But you'll get rebound hyperexcitability from Benadryl, so your last 4 hours are not going to be deep sleep. So that's why it's not a good sleep aid.
Well, I'm talking more about like if I'm really having a big hit of allergies.
Yes.
If I'm ever going to take that, I have to do it at night.
I recommend chlortrimeton for that. It has less side effects. It's in the same class as Benadryl, but it's cheap. I was on chlortrimeton in the 60s. That's how old I am and how old the medication is. But it's a less sedating form of Benadryl, basically.
Now, in terms of treating seasonal allergies, are there things we can do that are not medication oriented?
Sure.
People talk about bee pollen, of course, that comes top of mind, but then even things around our house with our vent systems and let's start with the natural remedies though.
Sure. Well, of course, I've been back here in Knoxville for 28 years. We hear very often people buying local honey that, there might be some factor in there that does help. I don't know. People love the taste for sure. But the pollen in honey is a large pollen. It's not the type of pollen that we inhale. Clover pollen and some of the heavier ones that some of the flower pollens are not significant allergens because they're too big to trigger an actual allergic reaction. But they can irritate the nose. And then there's some old studies looking at high dose vitamin C, 1,000 milligrams to 1,500 milligrams a day might cut it back. But, just like a lot of the rheumatology treatments, this is a condition that waxes and wanes. So if you're lucky enough to eat a carrot right before the pollen goes down, you might think carrots work. But we can't find any scientific proof that pollen works. But, boy, it sure tastes good.
Yeah. Yeah, well, good local honey's really good. Many people do stay indoors when the pollen and mold is high. But sometimes we can have a lot of allergens in our home.
Yes.
So how do we manage that in the home?
Well, that's one good reason to get allergy tested, so you know what you're allergic to. The dust mites. A lot of people think that's because they're not good housekeepers, and in reality, it's the dust mite is in the upholstered furniture and the bedding and in the carpeting. And you can't get an air cleaner that's going to help you there because it's going to get released with human interaction. It's going to hit you before it hits the air cleaners or the central air system. But just a good high-efficiency filter in your central air system, one with a MERV rating of 12 to 14. It's a MERV MERV rating, and
are some of those too thick that you see at the store?
Yeah, the allergy filters are 18 to 22, and that means your system's going to have to work a lot harder to pull the air through that thick filter, and they get clogged up real easily too. So, and there's just a very limited number of studies looking at particulate counts in a house that had a high efficiency filter in it, and they replaced it with an allergy filter and vice versa. And when they did particulate counts actually in the rooms of the house, the particulate counts weren't any different. Because remember, that air has to blow through an air duct that could have particulates in it. And for sure, when the air blows out, it stirs up a lot of the particulates on the countertops and just in the air blowing through the curtains and things like that. You're gonna stir up a lot of.
So a MERV of 12 to 14 is where we get the sweet spot where your unit can perform well.
Yes.
And you filter out the most of the stuff.
Yes, and you should use those even if you didn't have allergies, just to keep your air ducts clean. Dirty air ducts. We buy houses that are older. I bought a 10-year-old house, and you're supposed to get those cleaned about every 10 years. The air ducts, but if you've had a high efficiency filter in there, you probably aren't going to have them cleaned very often.
And then we should change those filters really monthly.
It really doesn't. Doesn't appear to be a difference in changing a high efficiency filter more than every 3 months.
3 months.
Yeah, you might feel better, but it's not going to change your airflow or your.
Well, we want to know what the data says, right? We it makes me feel better at night.
Yes, exactly.
Yeah, we're visiting with Dr. Ty Prince. He's with the Knoxville Allergy, Asthma, and Sinus Center, and we visit with him every year. He's been a good friend of the show. When we come back, we'll talk about other options for treatment, things like surgery, allergy treatments, things like that. So stay with us as we'll have more with Dr. Ty Prince. You're listening to More Living with Jim Brogan here on News Talk 98.7 WOKI.
Welcome back to News Talk 98.7's Brogan Financial Studios, where Jim Brogan is coming to you live with important news and advice to help you achieve your dream retirement. Get ready to learn and live. Here's your host, Jim Brogan.
Welcome back to More Living here on News Talk 98.7 WOKI. I'm your host, Jim Brogan. We're visiting with Dr. Ty Prince. He is with the Allergy, Asthma, and Sinus Center. He's a Knoxville native, and he's been practicing in allergy, asthma, and clinical immunology for adults, adolescents, and pediatric for years, over 25 years. Let's talk about other treatment options, Dr. Prince. What about surgical options for people who continually have severe allergies, or is that more of an underlying sinus issue?
It's more often than not, it's more of a sinus issue, but you also have probably the most common cause of chronic nasal obstruction is septal deviation. And that can be a health issue. When I first got out into practice, I was taught that it was more of a quality of life issue. But when I started studying sleep medicine, I found that nasal airflow is a huge issue for sleep. So if you look up any medical condition in the medical books and look up that condition plus snoring, you'll see a worse outcome. Now, some of that is because some of us that snore, including myself, are a little overweight, but it's still a factor in quality, not just quality of life issue, but it can be an issue for high blood pressure, diabetes, and some of the other medical conditions too. But a simple septoplasty is a 5-minute surgery. The otolaryngologists, the ENTs, perform that surgery. And then, of course, you have various types of sinus surgery where you have obstructions in the drainage of those sinuses, and those chronically infected sinuses are going to accentuate your nasal symptoms dramatically. So just a simple little temperature or barometric pressure change will trigger some sneezes and some coughing with a chronic sinus infection.
Now, what about some of these treatments that literally clean the nose, Navage and those things? Are those pretty good?
Yeah, those are, they've done the studies on those, and all of your nasal sprays have had studies done where they have a placebo, and you'll see the placebo is going to work about 40-50% of the time compared to the actual drug, and the placebo is just going to be saline spray with a whatever fragrance is in the drug you're comparing it to. But yeah, it's those. The studies are pretty good, but you got to be real careful. You have to use distilled water with those, or already pre-mixed saline be careful not to use tap water, and be careful not to let that water pool in your sinuses, especially if you've had sinus surgery before. You can get that water, you can get that saline pooling in your sinuses, and that's a great culture for not just the common bacteria, but some of the more resistant bacteria can grow in there.
Now, I know sometimes, viruses can kind of mimic the effect of allergies.
Yes.
Runny nose, congestion, sore throat, a headache. And, man, when I get bad allergies, I mean, I feel worse than when I have a virus, it seems like. How do you know it's allergies and not a cold?
Great question. And one thing for sure is the viruses are very contagious. So if another family member or a coworker comes down with exactly the same symptoms at the same time, that's probably going to be a virus. But you're going to get more systemic fatigue and body aches and things like that. There's going to be more of a sudden onset, usually within an hour or so. Your viruses, you feel bad from head to toe. Now the type of cold symptoms you get with allergies tend to go along after you've gotten stirred up for a bit, so you start getting the sneezing and the congestion and the itchy eyes, that kind of thing, and then
but more comes over a period of hours instead of real quickly.
Yes, and it gets better generally with antihistamines, where when you have a cold, the antihistamines slow your drainage down a little bit, but you still feel bad.
One thing that I've noticed for me is if I get a little bit sick, if I get a cough or a sore throat, just a little bit, or just a small cold, it seems like within a couple of days it turns into full-blown allergies.
Mm-hmm.
I would imagine that it's just because my immune system's been weakened, and then all of a sudden the allergens, I'm reacting to them more. Is that a correct assumption?
Yeah, you will see the allergies get worse when you have a viral syndrome going on. So, same way with as I was saying with the sinus infections, your nasal allergies, and sometimes your itchy eyes and throat will get worse. But your immune system sort of gone down when you're trying to fight that virus, and it'll give a chance for the allergies to create more problems.
Now, Dr. Prince, what is anaphylaxis, and if you have severe allergies, are you at risk for an anaphylactic reaction?
Well, you're not from typically aerosolized stuff, although rarely we'll see some anaphylactic reactions to aerosolized nuts and chemicals and things like that. But it's pretty uncommon. You'll see about one person per state per year that dies of an anaphylactic reaction from food, and one or two that die from bee stings. But most people don't even know of anyone that's ever died of an anaphylactic reaction. But there's different levels of anaphylaxis, and you have to be careful. What is determined as anaphylaxis. The true definition of anaphylaxis is you got two organ systems involved. So it might be your airway and your vascular system. So your throat gets tight and your blood pressure drops, but you've got to have two or more of your organ systems involved to have a true anaphylactic reaction.
So you ingest something or take in something that you're allergic to, and you have two major organ systems that start shutting down.
That's correct.
Okay. Now, I do want to pivot a little bit into asthma, and I know that's a true specialty of yours as well. The Academy of Allergy, Asthma, and Immunology states that approximately half of all asthma in adults is caused by allergies.
Yes.
How do seasonal allergies affect asthma, and are there some other triggers that can cause an asthma attack?
Well, when you look at the chemistry of the allergic reaction, you actually find out that it's a higher percentage that are affected, a higher percentage of asthmatics that are affected by asthma. A lot of the newer treatments, these biologics we call them, affect that pathway. It's called the T2 high pathway. T2 is a T helper cell, and they were discovered back in the 90s, and they were found that allergic people had high numbers of these T helper allergic cells in their system. And make a long story short, most of the newer treatments will cover that pathway. They'll block a step or a chemical in that T2 allergic pathway to have an effect. So what you wind up with is especially here in East Tennessee, is a very common trigger for the asthma, and cause those small airways to spasm and cause the wheeze and the shortness of breath.
Well, Knoxville has been named, according to the Asthma and Allergy Foundation of America, Knoxville is one of the most challenging places to live with asthma. Now, talk about the difference in, Dr. Prince, in asthma in adults versus children. And if an adult gets an adult diagnosis,
yes,
what should they do?
Well, it's important to get that person assessed when they start having asthma problems, because that's often when you're going to find your major trigger for your asthma. So in adult asthmatics, even though the highest percentage, studies are 50 to 70% of adult asthmatics are allergic asthmatics, but we look for things like acid reflux, aspiration, chronic sinus infections can trigger those asthmatics. And so what we rush to do is to find the major triggers of that asthma, because if you can get rid of the triggers, the asthma is going to go away.
Now, when we think about treatment options, or we even think about getting care for our allergy issues, when do you consider seeing an allergist versus your primary care doctor?
Well, you can, people can make that decision. Basically, if you want more information about, A, the triggers of your allergies, B, how to adjust your environment to reduce your exposure, and C, the best medicines to take, it's best to see an allergist. Certainly, if you have asthma, we think we do the best job at, again, identifying those triggers and changing your environment, hopefully to reduce the amount of medicine that you're going to have to take, and maybe even get rid of the asthma if possible.
We're visiting with Dr. Ty Prince. He is with the Allergy, Asthma, and Sinus Center, and we have him on every spring. He's a good friend of the show. When we come back, I want to get into food allergies and how well can we actually test for that. And then, are there new protocols, new treatment options on the market? I say new, but how have things evolved where maybe you don't have to go in 2-3 times a week? What are the different options when you really, really want to try to start aggressively treating your allergy issues? So stay with us. Now, I'm also going to have my dollars and cents segment, my thoughts on the current banking issues in the United States. So stay with us. This is More Living with Jim Brogan on News Talk 98.7 WOKI.
Welcome back to News Talk 98.7's Brogan Financial Studios, where Jim Brogan is coming to you live with important news and advice to help you achieve your dream retirement. Get ready to learn and live. Here's your host, Jim Brogan.
Welcome back. Thanks for tuning in this morning. It's More Living with Jim Brogan, where it's all about living the best years of your life your way. We're with you every Saturday here on News Talk 98.7 WOKI. We're here from 9 to 10 a.m. and again 3 to 4 p.m. in the afternoon. Today we're visiting with Dr. Ty Prince. He comes on every year. We talk about seasonal allergies. He's with the Allergy, Asthma, and Sinus Center here in Knoxville. And of course, they've got locations all over. It's always good to talk to him about allergies. Before we get back to that, however, it is time for dollars and cents.
Want to be sure you are getting the most out of your retirement? For all the years of your retirement? That's the primary goal of More Living with Jim Brogan and our Dollars and Cents segment, where we provide you with an important financial tip that will help positively impact the quality of your life in retirement. And now, here's Jim with this week's Dollars and Cents tip.
We've all seen the headlines over the last few weeks of is it a crisis? But let's call it a crisis in the banking industry. What in the world's going on, and what can you make of this, and what do you need to be doing about it? If we look back to the beginning of last year, January of 2022, the federal funds rate was 0 to 0.25%. Fast forward a little over a year to March of this year, and it's now 4.75 to 5%. So it has gone up 4.75% in 14 months. So such a quick increase in rates has put pressure on banks to offer higher interest or else see their consumers move their deposits to other low-risk, higher-yielding instruments. So it's what do banks do with your money when you put your money there? They take your money and then they take it and invest it out to earn a higher rate than they're paying you, and that's called a spread. And they do that by loaning it out to businesses and individuals. They buy treasury bonds, other interest rate sensitive vehicles. But most of it, they loan it out and do things like that. So in other words, it's not liquid. And so and then the treasury mix that they have, if you remember, when interest rates go up aggressively, bond values go down. The aggregate bond index in the United States last year went down 13%. As bad a year as we've had on record since World War II. And bonds that are more than the longer the bonds, the more they go down. So bonds with over a 20-year duration last year went down over 30%. So then if, typically when you have $100 on deposit at a bank, the bank has about $10 in reserve backing that money. The rest of it, they can't get to it. It's loaned out, it's invested, it's in things that are not liquid. So then if all of a sudden people start taking their money out and they have to start selling treasuries at a big loss, then it's an issue. Now, the issue with Silicon Valley Bank and with Signature Bank of New York, both of those banks took really unnecessary business risks. And they were different, but they both backed highly speculative startup type stuff. Now, in the case Signature Bank in New York, it was crypto stuff. Silicon Valley Bank had an extraordinarily high amount of long-term bonds, which is just silly to have had that going into 2022. That's kind of an oversimplification of what's been going on, but when people started cashing in, the banks were having to realize big losses on selling their treasuries, and frankly, they don't have a ton of money to be able to meet a mass liquidation or a run on the bank. And so that's what kind of led to their failures. Now then, what's happened is the FDIC, President Biden has come in and said, they're going to back all the deposits at those two banks. And they're also providing an emergency lending program for other banks to be able to get money if they need to meet clients' liquidation needs. So in other words, if you're taking your money out of the bank, and a lot of other depositors are doing that, and the bank doesn't have the money in reserve, and they don't want to sell off treasuries or bonds at a big loss, the government is there for an emergency lending type of capacity. And then, of course, this past week, it was announced that the FDIC is looking into if they can insure all deposits. So what's my take of all this, and what should you be doing? I think consumer confidence and consumer trust in the banking system is so critically important because, again, if there's a run, even a super healthy bank that really manages and is very conservative with their approach, you have a run on the bank, you have 20-30% of depositors take their money out, the bank can't meet that need. Now, the government's saying they'll step in and help, but consumer trust and confidence is so important. I think that's what Washington is trying to manage in this. Now, this is still yet to be determined how this evolves. So while the government has indicated a willingness to provide a backstop, if you will, for bank deposits, I recommend you review your current deposits to ensure they fall within FDIC limits, which is typically $250,000 per bank per tax ID number. Okay, so if you're married, you get $250, your spouse gets $250. If you have a business tax ID number gets $250. If you have another business tax ID number, it gets $250. And I recommend you review that and make sure that your deposits are fully insured. There are a lot of great tools to be able to do that. In the brokerage market, like what we deal with at a company like TD Ameritrade or Charles Schwab, we have access to hundreds of banks around the country and can spread money around to stay within those insurance limits. And CD rates now, we're almost getting 5% on 4-week CDs. Almost 5% on a 4-week CD. So there's some good options out there. So look at your cash management. Are you earning some decent interest? And make sure you are fully insured would be my number one recommendation right now.
That's our Dollars and Cents segment for this week. You can find this week's Dollars and Cents segment and others by visiting BroganFinancial.com.
Please check us out at BroganFinancial.com. You can catch all of our show's podcast at BroganFinancial.com. Click on radio. We'll have this show with Dr. Ty Prince. We'll have it up on our website by Tuesday afternoon where you can listen to it. We also have just a plethora of information. I've got a blog giving my thoughts on the banking situation. If you go to BroganFinancial.com and click on blog, we've also got a lot of great resources there so you can make informed and prudent decisions that can impact the quality of your life. Now, my next class is through Pellissippi State's adult education program in Hardin Valley, and it is a one-night class, tax planning in your retirement. So we specifically, in 2 hours, dive into several areas of where you can really make an impact with your tax planning. Typically in retirement, in the early years especially, you've got more control over your income taxes than at any other time in your life. And it's important we take advantage of that. So, it's not how much we make, it's how much we get to keep. You can go to BroganFinancial.com and click on classes. You can also go directly to PellissippiTaxPlanning.com. That's PellissippiTaxPlanning.com. It's on Thursday evening, April the 11th. Again, Thursday at April the 11th at 6:30 p.m. Go check it out at PellissippiTaxPlanning.com, and you can download a syllabus and click to register. It's that time of year where we start seeing a lot of seasonal allergies, and as Dr. Prince has mentioned in one of our earlier segments, the hard freeze last weekend just maybe on the allergy side maybe just delayed things a little bit, didn't necessarily kill things, and didn't really do probably anything for the mold. So this is such a big topic every year, especially with all the allergens in East Tennessee. Dr. Prince, I do want to talk about food allergies. As many as 32 million Americans have food allergies, including nearly 6 million children. Now, what's the difference between a food allergy and a food intolerance?
It's a great question, Jim, and I get a lot of patients who come to ask that question to get that identified. And an intolerance is just the way you're tolerating the food. Basically, it most often is how that food gets digested. For example, if someone's on a low-fat diet and they just decide to go to a restaurant and have a good piece of red meat and and a lot of butter on their potatoes and things like that, they're gonna get some intolerance with that. They're not going to break that food down as well as they have been. So if you have a major shift in your fat or protein intake, then you're not going to break it down as well. The most common intolerance is lactose intolerance. Those people can't have milk products that have lactose in them, or they might be able to tolerate a small amount of them. As with an allergy, they take a sip of milk, and the reason is that with an allergic reaction, your immune system gets involved. So you got those antibodies in your tissues waiting for the smallest amount of a milk protein or other food allergen to start to trigger off that cascade of reaction.
So I guess with something like we hear so much about with gluten, some people are simply have some intolerance to it, but then some people are allergic. They can't eat it. It just...
Well, you have a wheat allergy disease. And you have other grain allergies. The gluten, the celiac is actually an autoimmune reaction to that protein, and that's a lifelong condition that you can never have any gluten. That's wheat and a lot of other grains as well. So that again is a different type of immune reaction. The allergic reaction is called a type 1. It's an immediate reaction, and that has the allergic antibodies involved, and it's just waiting 24 hours a day for you to ingest that and to cause a reaction.
From what I see, Dr. Prince, testing for normal allergens, you do skin tests, you do all these things. What about testing for food allergies?
Yes.
How far along are we? How reliable is that data?
It's becoming more reliable, Jim, but it never has been truly reliable. We use it as a guide more than anything else, but you have to have a lot of information in addition to that positive test, because you get a lot of false positives and a lot of false negatives with food allergy testing. What we know for sure is that these food sensitivity tests they do not, the immune system is not involved in a sensitivity, and the IgG it's called, that's an infection fighting antibody. And we have not had any studies showing that identifying an IgG against a food can be reproducible in the clinic. Meaning, if we do a double-blind challenge and you have a positive IgG test to a food, and we do a double-blind challenge, there's not a study ever produced that shows that if you do a double-blind presentation, that the patient or the practitioner can identify that food based on a previous IgG test. So please don't waste your money doing those tests. They are 100% useless, in my opinion. Now, we test for IgE, that's the allergic antibody, and we generally have to do both the skin test and the blood test to check for that antibody. What's changed, the biggest improvement that's come with food allergy testing is now we're doing component testing. So you're looking at each piece of that protein, that food protein, and finding out what part they're allergic to. And some people will be allergic to part of it that has the potential for an anaphylactic reaction. But other people, like myself, I'm allergic to peanuts, but I'm allergic to a part of the peanut that doesn't typically cause anaphylactic reactions. So I get a little nasal congestion with my peanut allergy.
That's a lot of information. Is there what are the most common food allergies you're seeing? I mean, we think of wheat and dairy, but what are the most common ones you're seeing?
Well, for sure, in adults, your most common is going to be shellfish and nuts as the most common adult onset food allergy, and with children, of course, it's the milk and the eggs and the soy and the nuts, the peanut butter and the tree nuts, those kind of things. But big changes in that as well too, where we used to try to avoid those foods in children who were born into a family with food allergies. We're now finding we actually need to introduce it early as opposed to holding it back, and then doing everything we can to try to get that food reintroduced very carefully, of course, with the allergist monitoring the situation. But if there's a chance with some of these children, a lot of these children with food allergies, especially the milk and the soy and the eggs and the wheat, if we can get that food reintroduced by the time they get to be about 6 or 7 years old, then they might tolerate it for a lifetime. But vice versa, if you hold it back from them, it might further develop that allergy into a lifelong allergy. That means carrying EpiPens the rest of their life and being careful at restaurants and that kind of thing.
Yeah, but it seems like more of us have talked about that of late, where people like try to put their kids in a bubble.
Yes.
And then they don't get exposed to all the things. I mean, we were outside playing in dirt all the time and doing things that kids aren't doing that today, right?
That dirt's extremely important. We've seen with the Amish community, the ones that leave the Amish community, those will develop more allergies once they go more to an American lifestyle of a house with central air and heat, an automobile, and microwave ovens. They'll start to develop more allergies.
That's very interesting. We're visiting with Dr. Ty Prince. We're talking about spring allergies. When we come back, we're going to talk about different treatment protocol. How has the industry evolved? What's on the horizon? So stay with us. This is More Living with Jim Brogan on News Talk 98.7 WOKI.
Welcome back to News Talk 98.7's Brogan Financial Studios, where Jim Brogan is coming to you live with important news and advice to help you achieve your dream retirement. Get ready to learn and live. Here's your host, Jim Brogan.
Welcome back. This is More Living here on News Talk 98.7 WOKI. Our next class through Pellissippi State's Adult Education is a one-night class on April the 11th. Pellissippi State, Hardin Valley, Tax Planning and Your Retirement. It is a one-night, 2-hour class, all things taxes. How to save taxes, not just in any given 1 year, but over the long haul. And if you go to PellissippiTaxPlanning.com, you can download more information, a syllabus, and click to register. Again, that's Thursday, April the 11th at 6:30, Pellissippi State at Hardin Valley, PellissippiTaxPlanning.com. We're visiting this morning with Dr. Ty Prince about seasonal allergies. He is with the Allergy, Asthma, and Sinus Center throughout East Tennessee. And let's talk about Dr. Prince's treatment protocol. We know about we get skin tests and then we go in for shots for a year. Everybody kind of knows about that. Well, I guess not everybody, but what is that still kind of the main course of treatment? Are there other options? How are things evolving with treatment protocol? I
think the biggest thing, Jim, is we're seeing we have a lot more rush protocols because people generally the average patient will stay on shots 3 to 5 years, but by the third year you're taking them once a month, and in those situations people don't complain about having to take their shots as frequently, but you can do a rush protocol where you come in for 4 hours, 2 days in a row, and we can take you up to full strength in 2 days, basically. And then you just have to come in every 2 weeks that first year instead of coming in weekly that first year. So those are probably some of the biggest changes. We're also using cross-reacting allergens now, so you can actually use less of each allergen, but because it's cross-reactive, we think it's more immunogenic, so it's less volume of material you have to inject into the patient, and we think less reactions. We have the national groups have not done head-to-head studies because it's hard to get them funded, but we think you have less reactions with these cross-reacting allergens. But still, the mainstay of the most aggressive treatment is to get immunotherapy and turn off the allergies instead of just taking medications that treat the symptoms of allergies.
So 2 days, 4 hours a day, that sounds kind of scary.
It can be. And
I guess you have to monitor that, right? They have to be in the office.
We put them in a room, and there's with the doctor feet away, of course. But you will see more reactions to that. But we treat people through them. I've only had a couple of patients in my whole career that said they wanted to stop it. It tends to be a patient that travels a lot of airline pilots and people that are on the road a lot but still suffer from bad allergies. Those patients are the ones that want to come in and get them knocked out in a couple of days, and then they just come in every 2 weeks the first year to get them suppressed, and every 3 weeks the second year, and every month the third year that way.
It seems like, in terms of regular allergies and food allergies, Dr. Prince, it seems like we have more problems with it today than we used to. Is it more we're just more aware?
No, it's clearly increasing. When I was a little boy in the 60s in elementary school, I think I was the only child at little old West Hills Elementary that had peanut allergy. Now you're seeing 1 or 2 per classroom. But clearly in the mid 80s and 90s, we started seeing an increase. Actually, the 70s, they actually think it started with the oil embargo, and people started insulating their houses better, and the indoor allergy levels went up in that regard. But we think this hygiene hypothesis shows that if we are too clean and don't get enough exposure to maybe a lot of ground-based bacteria, that we're gonna develop more allergies.
So spending more time in the house causes more problems.
Yes, it does. Yes, we think. Yes.
You're with the Allergy, Asthma, and Sinus Center. How can people find out more information about your practice? And you're located, you got easy access to your offices.
We have
right?
40 offices in 4 states. The majority are here in East Tennessee. So how
can people get hold of you?
AllergyASC.com and just whatever. You can look that up on the internet, and 584-8588 as well too.
So Allergy ASC.
Yeah.
So that stands for Allergy, Asthma, Sinus Center, yes. AllergyASC.com.
Yes. Exactly.
Well, Dr. Prince, it's always great to have you with us. You always are just a fountain of information. I learn so much every time I have you on. So thank you for taking time out of your busy schedule.
Jim, thank you. It's an honor to be here.
Yes, sir. That's Dr. Ty Prince. He's with the Allergy, Asthma, and Sinus Center You can go to allergyasc.com. Again, check out the next class I'm teaching at Pellissippi State, Tax Planning and Your Retirement. It's on Thursday, April the 11th at 6:30. It is a one-night, 2-hour class. Go to PellissippiTaxPlanning.com to download a syllabus and find out more information. Thank you for tuning in this week. We've been talking about seasonal allergies and asthma and immunology because greater health provides for more living so you can live the best years of your life your way. Thank you to Riley for engineering the show. Thank you to Jill for producing the show. Have a very blessed weekend. This is More Living with Jim Brogan here on News Talk 98.7 WOKI.
The views expressed by Jim Brogan and his guests are not that of Cumulus Media. Any discussion of financial, legal, and tax planning strategies is not intended to be individualized advice and is general in nature. Always consult with your advisor for advice specific to your needs. This program's content does not represent a recommendation of any particular security, strategy, or investment by Jim Brogan or Brogan Financial Incorporated.